Hello and welcome to this webinar hosted by EMG Health. In this session, we're delighted to have Jonathan Sackier present on innovation, lessons learned from a surgical neoterics perspective. Now, before I let Jonathan take over, let me just give you a quick introduction and background about him for those of you that don't know him. So Jonathan is a physician entrepreneur with a diverse background, including clinical practice, academic work, and education, providing him with real-world experience of how the medical system works in the UK, USA, and globally. As an inventor and entrepreneur, he has raised money privately and publicly, secured intellectual property, started companies, built scientific and corporate brands, taken products through the regulatory process, and participated in mergers, acquisitions, in and out licensing, asset sales, and public offerings. So this generally puts him in an excellent position to present on this topic in particular. Now, over to you, Jonathan.
Thank you very much, Sen, for that very nice and very flattering introduction. I think basically the truth of the matter is I just don't sleep very much, so I have to keep busy. The purpose of this talk is really to hopefully inspire some of the folks listening to realize that there's no reason why they shouldn't pursue an idea they have. And in fact, I would humbly suggest that it's our obligation as those working in the healthcare professions to try and innovate, to try and improve the lot of the people who matter the most, our patients. The title includes a word that may not be familiar to many. It certainly wasn't familiar to me as I was looking for the right title. A surgical neoterics perspective. So, let's see. The word neoteric, where does that come from? Well, it's actually an old word that means something new or one who advocates for something new. For instance, new use for duct tape might be one such flippant example. One thing that Sen didn't mention, I'm a very passionate aviator. I was learning to fly airplanes before I learned to fly motor vehicles, and I like seeing the world through that perverse perspective. And you will see I'll use this as a theme as I explore innovation. I'm also very privileged to write for an aviation magazine, and one of the other contributors, Rod Machado, once said, when teachers are speaking, only 11% are paying attention, 23% are thinking about personal issues, and 66% are having a fantasy. So regardless of what I say, hopefully at least 2/3 of us will be having some fun over the next few minutes. First of all, I think it's very important that we consider terminology. You have to have the correct lexicon. The words innovation and invention seem to be used interchangeably by some, but they're very different things. So for instance, an invention is the creation of something new. So people might say, well, the iPhone, that's something new. Actually, it's not. An iPhone contains inventions like GPS or microchips, but it's an innovation. It's the combination of things and finding new uses for them. Let's expand on that idea. Here you can see a grid with markets existing to new up the y-axis and technologies existing to new along the x-axis. And that forms 4 kinds of innovation. The first, as I say, it's the concept of the use of an idea or method. An incremental innovation is where you take an existing technology and put it into an existing market. That might be the new model of a motor car, right? A disruptive innovation is where you take a new technology and you put it into an existing market, right? Let's say an architectural innovation is where you take an existing technology and you put it into a new market. And the radical, which is the most disruptive of all of them, is a new technology into a new market. An example of that would be robotics being used in the operating theatre. This was my son when he was much younger and much cuter, and he took my scuba gear and decided that this qualified him to be an astronaut. And he was insistent that I apply to NASA on his behalf. Awfully cute. He once asked me what it was I now did. And I said, well, I'm a recovering surgeon. I'm addicted to aviation. I'm an inveterate and ludicrously optimistic and highly recidivist innovator. Well, that word, you'll see that I love words and the meaning of words. It comes from the French recidiviste, meaning to relapse, or from the Middle French or medieval Latin, basically meaning to fall back. But I like to think of innovation, which is most of what I do, some invention, but mostly innovation. It's falling forwards. It's trying to control gravity. It's using the power of gravity to pull you towards something that's going to fundamentally change, in my case, the delivery of healthcare. Yogi Berra famously said, when you come to a fork in the road, take it. What a wonderfully creative and humorous man he was. So continuing the theme of aviation and surgery, in aviation, we use checklists. A diligent pilot uses checklists. It makes sure that you keep, as we say, the dirty side down and are available after your last landing to be available for your next takeoff. Recently, checklists have found their way into surgery. This is an innovation. And I think we have to thank and reference Atul Gawande for his brilliant work in this arena. In an aircraft or in the operating theatre, ad hoc behaviours are totally inappropriate. Flying an aeroplane and suddenly deciding, oh, I think I'm going to swoop low and spook those cows in that field over there, that normally leads to an interesting conversation with the regulatory bodies and very possibly to damage to the aircraft and those carbon life forms seated within. In an aircraft, we want an airframe that's rigid, and we want an operating room table that's rigid. Rigid airframes, no our tables, good. Rigid thinking, bad. We use an expression in aviation, flying ahead of the airplane, which means you're constantly asking yourself, what would happen if? My son used to say, what would happen if I put the flaps down as we're barreling along at top speed? So, well, some very bad things that would happen. First of all, I would shout at you and then we would plummet to our deaths. Right? You're constantly asking what would happen if we do the same thing in the operating theatre. And if you're thinking with that mindset, then maybe, just maybe you're thinking, how would I address that problem? Do I have the tools available to me, both tangible and intangible tools, to solve any problem that might arise? There is a surgical, there is a medical equivalent of staying ahead of the airplane. I'd like to now reference a gentleman whose work I adored, Arthur C. Clarke, a British innovator, author, and great thinker. He wrote 2001: A Space Odyssey, for those who are not familiar with his work. He devised some laws as they applied to science. Clarke's first law: when a distinguished but elderly scientist states that something is possible, he's almost certainly right. When he states that something's impossible, he is very probably wrong. His second law said that the only way of discovering the limits of the possible is to venture a little way past them and into the impossible. His third law: any sufficiently advanced technology is indistinguishable to the uninitiated from magic. And if you think about some of the things that have developed in medicine in the last 10, 20, and certainly 100 years, to the great thinkers of the 1900s, the 1800s, the 1700s, this would seem indistinguishable from magic. You know, we as physicians have a profound and almost religious obligation to do the right thing for our patients, not to massage our egos, the right things for our patients. And a bowl of cherries or a chair of bowlies, it's a very, very thin dividing line between good and better. And sometimes the enemy of good is better. Any invention or innovation should be promulgated purely because it does good in the world, not massaging one's ego. As an example of invention and innovation, I'm going to reference anastomosis, the technique that we use in surgery to join two ends of a structure together, like the bowel, for instance. It turns out that the modern techniques we use actually go back quite a long way into history, to Sushruta, the Buddhist monk, to Nicholas Sen, the use of metal plates to join bowel together. It was called the Sen's plates, Nicholas Sen's plates. And one cunning chap in 1895 thought that wouldn't it be better, instead of using metal, to use something biological? And he developed a means of joining the bowel together with slices of potato. Really quite intriguing. That device that you can now see in the middle is called the Valtrak. It was a button that clicks together, and it's made of polyglycolic acid, the same substance that's used to make dissolvable sutures. But it's actually based on a design that came from the 1890s from a chap named John Benjamin Murphy. So to quote the Bible, Ecclesiastes specifically, there's nothing new under the sun. This was an innovation. It looks like an invention, it's an innovation. And then Mark Ravitch and Felician Steichen took some developments that came out of Russia and brought the modern age of surgical stapling to bear. Again, if you look back in history, you'll see that people were using the pincers on an ant's head to join skin together. So the idea of using metal staples was not that disruptive, if you will. You may wonder why in a talk on innovation, I'm showing you a picture of a 1950s refrigerator. Well, one of the companies that makes very good refrigerators is a New Zealand company called Fisher & Paykel. And in the 1950s, they were making refrigerators and washing machines and dishwashers and that kind of stuff. One day, Maurice Paykel, one of the founders of the company, was having a chat with his next door neighbor, so the story goes, who was an anaesthetist, and was telling him all about these wonderful new ventilators that were keeping people alive. However, they were having a problem in that the lungs were drying out and people were getting cold. And Paykel said, well, that's very simple. You just need a condenser like we have on refrigerators. And he built the world's first ventilator, warmer and humidifier. And it basically took the gas out of a refrigerator, warmed it, and humidified it, and thereby obviated the damage to the lungs. That's a picture of tundra, right? It's dry and cold. And that's what the environment is like inside a refrigerator. You want that. You want it dry and cold. You want to remove humidity, right? You want to ensure it's cold. When you're ventilating a patient, you want the opposite. Well, another innovation is to take that same methodology and warm and humidify the gas that surgeons use when inflating the abdomen to perform a laparoscopic procedure. And that technology is now being disseminated around the world. So sometimes you need a little bit of serendipity in that you need a next door neighbor who happens to work in an industry that has something to offer you. These are some pictures of just some various things I've been involved with. The bottom right-hand corner, you can see a technology that was developed to provide virtual medicine. Pre-COVID-19, this was considered sort of a nice to have. Now, this era, it's a gotta have. On the left-hand side of the screen in the middle, you can see a sort of a red tube that's supposed to represent a blood vessel with a tube inside, delivering microbubbles containing medication to stop arteries constricting after an angioplasty. This is not an invention, it's an innovation. It's a combination of a known drug, a known delivery system, an ultrasound to do something that put them together. It looks like it's an invention. It's an innovation. So why endeavor to innovate? Why do this? Well, firstly, obviously, to improve outcomes in the patients that we serve. Second is to make the world a better place. Third would be to avoid Alzheimer's. We know that mental activity protects us against senility. So innovate, invent. And there's a British chap by the name of Sir Ian Carruthers. He wrote a wonderful document called Health and Wealth. It was all about the virtuous circle you create if you have businesses bringing new technologies to market to improve the health of a nation, because they will employ people, that will improve the wealth of a nation, which improves the health of the nation. It's a virtuous circle. And also in the process, you meet amazing people. This is a rock band, for those of you who don't know, called Incubus. The chap on the right side of the picture is Mike Einziger, who's a friend of mine. Mike is a spectacularly clever gentleman, and he is a citizen scientist, and he and his lovely wife, who is, I think, actually a lot smarter than Mike, bless you, Mike. Anne-Marie is an amazing violinist. They made an observation in nature, and I've had the great privilege of trying to help them take that technology from their inquisitive and smart minds into a technology that might, just might, prove disruptive in the world of oncology. So innovation can come from anywhere. You don't need a degree to innovate. What lessons have I learned on my wonderful journey? Attorneys and accountants, they're useful, you need them, but don't let them run your business. Their motivations are somewhat different to yours. Expert opinions, certainly garner them, listen to them, but don't, if you are passionate, don't be led by them. I will tell you that Dr. Dotter, the chap that invented the concept of angioplasty, when he teamed with Bill Cook, who founded one of the world's largest medical device companies, Bill told me that when he presented the idea of angioplasty to a room full of cardiologists and cardiac surgeons, their response was, "What a stupid idea." And that's when Bill said, that's when I knew I was onto something really important. Intellectual property is important, but don't guard your ideas such that you won't talk to anyone. Most people are not going to steal your idea, although of course it can happen. You've got to understand where you go for money to develop your ideas and the sort of people to deal with. And I'll tell you the best lesson I've learned: listen to your gut. If it looks too good to be true, it usually is too good to be true. And think very carefully about the sort of people you want to work with, both on your corporate and on your advisory boards. I have 5 rules for the things I get involved with. Rule number 1 is adequately stated in the title of this excellent book by Dr. Robert Sutton. And I'm not going to read it out because I'm a gentleman, but that's a very, very good rule. Second, we spend a long time dead. So live your life with passion, live your life with conviction, and there's no such thing as a stupid idea. In the process, you'll learn something new, and that's exhilarating. It keeps you young and vibrant. Fourth, leave the world a better place. We are so privileged in healthcare to be able to do things that improve the lives of other people. What a blessing that is. And fifth is refuse to lose. Thomas Edison, of course, was famously quoted as, when he was questioned by his assistant about, we failed. And he said, no, we haven't failed. We've just found 10,000 things that don't work. And to quote Nelson Mandela, recently a friend of mine educated me about a quote that he stated, which is, I never lose. I either win or I learn. I think that's a wonderful, wonderful philosophy. H.G. Wells, another of my favorite writers, said, we all have time machines, don't we? Of course, he wrote the book, The Time Machine. We all have time machines, don't we? Those that take us back are our memories. Those that carry us forward are dreams. People who do yoga can sometimes, with the help of some props, find these marvelous positions that bring them peace, serenity, and happiness. That takes time, dedication, and commitment. It's the same thing with innovation: time, dedication, and commitment. Yes, in life, there are shortcuts, but trust me, shortcuts normally lead to a headache. Thank you very much. And Sen, I hope you and the audience enjoyed this contribution.
Absolutely. Thank you so much, Jonathan. What an excellent presentation. We do have time for a few questions, and I've already had some come through. So I will read them out. And if you don't mind providing an answer for the audience, that would be absolutely fantastic. The first one is, can you talk a bit about how one transitions from a university lab program to a company, and when should that transition take place?
What a great question. Universities have their place. Universities primarily exist to transfer knowledge from the heads of professors into the heads of students. The grant process is an excellent way to validate an idea, because a grant that's peer reviewed means that smart people have looked at it and said, yeah, there's something here. It also means that the work can be done in a cost-effective manner to some degree. The issue is that intellectual property, patents specifically, American and British pronunciations, are best written by experts in the field. And sometimes that's not the university. So I'm a big believer in having a robust relationship. It should be a dating game. So if a researcher is working within the university environment and thinks that this might lead to something that has commercial validity, form a relationship with business people early, introduce them to the university, and develop ideas collaboratively, with an understanding that when it's time to write the patent, get the very, 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 very best patent attorney you can to do that. And when it's time to start using other people's money rather than grant money, which of course is also other people's money, but there's peer review. If you're going to business people who don't understand the science, you have a profound and moral obligation to make sure that what you're telling them is right. So I believe in a gradual transition. What tends to happen is that people either take it out too soon and they end up wasting investors' money, and then they've burned a relationship for when they do have the great idea, or too late, by which time patents have been written that have compromised the commercial opportunity for humanity, but also for the university that wants to make its return on investment.
Thank you. Another question here. How do you decide when to form a board and who to invite?
Yeah, it's very easy to get people on your board. It's sometimes not so easy to get them off. You want to, I think, start with a blank piece of paper and say, what do I want? Now, this is a corporate board, right? A board of directors, which I'm a huge believer of, the value of that, because you're judged by the company you keep, right? So if you have great people on your board, that will help you. Of course, you have to listen to what they say. And sometimes inventors are challenging. I'm sure I've been challenging in my time. But I think you need to set down what skill sets do I need on the board, and then think about how am I going to work with that board. And then I think you really need to go through a process. You don't meet someone and marry them on the first date. You want to know that your philosophies, your moralities, your drive are in harmony. You want people who are going to contribute. You want people who are going to challenge you. You don't want people who are just going to say yes. And it's a process. And quite frankly, if you've never done it before, talk to people who have, get some guidance, and look at really good companies that have really good boards. Oh, and by the way, when you form a company, make sure the memoranda and arts, the founding principles of the company, say things like, the directors will serve a term of 2 years, and then will be subject to election or re-election, and maybe even have terms in there about, how if the relationship's not going well, it can end without tears before bedtime.
Thank you. And the final question we have is, I guess this relates to the IP point that you mentioned earlier. If I have an idea, how can I be sure nobody will steal it if I talk to them about it?
Well, you can't. I mean, the truth of the matter is you can't. Industrial espionage happens with things for which there are multiple patents. And remember, there's different kinds of intellectual property. There's patents, which is basically, it has to be something non-obvious and protectable and reproducible. And the purpose of a patent is not to protect you, it's to show how to exercise an invention. There are copyrights, there are trademarks, and then there's know-how, right? All of those things have value. Certainly speak to a very good patent attorney, certainly document. If you have an idea, write it down, sign it, date it, and keep 2 copies. You keep one and have your attorney keep another, because the date, the primacy, that becomes very important with litigation. Remember, all a patent is permission to litigate. So having a patent doesn't mean you're protected. It means that you're going to be litigating. You're going to be paying attorneys, bless their cotton socks, to protect your intellectual property. You know what? If you've had a great idea, don't go and stand on the rooftop and talk about it, because once it's in the public domain, there's no patent to be had. You're done. And you know, again, you've got to think, what am I doing here? Am I doing pure science, or am I looking to do something that I can bring to the market as an invention or an innovation? There are plenty of great people who will be very happy to talk to inventors early in the process and help them through it.
Fantastic. Thank you so much, Jonathan. We will wrap it up there. We've had 3 questions, and I think that's enough for you. And thank you so much for taking the time and sharing your knowledge again, Jonathan. And thank you to anyone who attended. Have a wonderful day.
Thank you very much, Sen, and thanks everyone.